Thank you very much for joining us on the program Healthy Living. I am Adesuwa Usauwage. We must apologize for coming on behind schedule due to circumstances beyond our control, but we're here now and ready to serve you. We thank you for your understanding. Today we will quickly open our lines, and you can call us on 052-290-573. And you can also send WhatsApp messages to 070-8734-1599. Those numbers are there on your screen. Today we want to look at malaria. This happens to be the great test of our problems health-wise in this country. And so many people die as a result of this, about 207,000 deaths. And that's quite a huge number. But we have some ladies in the studio who are going to be talking to us about this. They are medical doctors, and they are going to answer all of your questions as far as malaria is concerned. And if you must call us, please reduce the audio level on your telephone sets or your radio set before you can reach us. So let me quickly introduce my guests to you. I have with me Dr. Lucy Eriba. It's nice to have you join us today, Dr. Lucy.
Thank you. Good afternoon.
And Dr. Mary Ehimigbai. I hope I got that right.
Yeah.
Okay, Dr. Mary, nice to have you join us today. So we are looking at malaria. Not too long ago, just last week here, the world celebrated, you know, the awareness for malaria. But unfortunately, in this country, Nigeria, the scourge is so large, so huge. And a lot of people begin to wonder, what is happening? What is the government doing? What is Edo State doing? What are doctors even doing? What are people doing to make sure that we try as much as we can to reduce malaria to its barest minimum? Is there a way out of it? So before that, doctor, when we say malaria, what are we looking at?
Yeah, malaria is a life-threatening endemic infectious disease, which is caused by the female Anopheles mosquito bites.
Okay.
And I can tell you that, like you said, it's a huge burden in Nigeria. Malaria constitutes a very huge percentage of the health problems in this country. It's even said that about 97% of Nigerians, about 173 million, are at risk of having malaria. Globally, 216 million are affected annually. And in this large number, 51 million are Nigerians. So you can see
that's quite huge.
That's really very huge. So it calls for a serious health concern.
Okay, before we go into that, let me ask Dr. Mary. Doctor, what are the symptoms of malaria?
Symptoms of malaria includes fever, chills and rigors, generalized body pains, weakness, joint pains, headache, nausea, vomiting, and in children they present with abdominal symptoms, abdominal pains. Those are the common symptoms. What we call lethargy, what we call malaise. Okay. Those are the symptoms.
So when this happens, what is one expected to do?
One is expected to seek intervention. One is expected to go to the hospital for treatment, because self-treatment, self-management is actually not advisable, because we have a lot of people around who are resistant to malaria because of self-management. Sometimes they take drugs that the doses are not complete, and at the end of the day, they come up with resistance. And they become febrile for a long time because of this resistance. So seeing an expert and going to the hospital for prescription and proper treatment is a good thing to do.
So Dr. Lucy, how long does it stay in the body, this disease, or the...
Yeah, really,
how long does it stay in the body before it manifests?
Yeah, what really happens is that after the bite, it takes about 10 to 15 days before the manifestation actually occurs. Because when the mosquito bites a human, it goes through the blood and to the liver, where it then multiplicates and reproduces. That is, it's from there it now moves again to the bloodstream and causes the symptoms that we're talking about. So if people can actually make prompt diagnosis and treatment, will go a long way in preventing further complications from malaria. Because I can tell you, malaria, apart from these complications that we've just mentioned, could also get to the other severe stage where we have complicated malaria, We can have things like cerebral malaria, when malaria gets to the brain. And when it gets to the brain, it begins to manifest. Patient can become unconscious, go into coma, can have seizures, they can have febrile convulsion, especially in children, because they are the risk group we're talking about now, between the ages of 6 months and 5 years. They are the risk group and pregnant women for malaria.
Okay, but the thing is this. In our environment, where we stay as Nigerians, a lot of people don't see it as a problem. Is it not ordinary malaria?
That's the
Take
problem.
this thing and don't disturb me with it. It's an ordinary malaria. You know, because when you say it's an infectious disease and it's very serious, you know, it brought some chills to me because people just say malaria, let's just go get something from the chemist and we are done.
For all we know, that is the reason why we're having a high prevalence in this country, because people are not taking it even as serious as it's supposed to be. I think malaria is one of the most abused diseases. Every little headache, every little pain, fever, people just attribute it to malaria. And that's not supposed to be. Because at least malaria, you can make a diagnosis of malaria. You make a diagnosis of malaria, say this is malaria, and patient is treated appropriately. Especially in children, because if they're not well treated, they now come down with complications that even when they go into adults, those complications still remain. Yes, they are still there. I was talking about reproductive age. You know, when these children are affected, when they become adults, it slows down everything about them. They just grow up to become children that they are brain damaged, and it becomes an issue.
Okay, Dr. Mary, how do we get people to come to the hospital on time? Because we trivialize this disease called malaria, especially mothers. We don't see it as something to be worried about. Please, can you just re-echo the fact that malaria is something to be worried about with some facts?
Yes, one of the ways is just what we're doing now, health education, to raise awareness about the severity of malaria. Like my president just said, it's 2 stages. It could be simple or complicated. That's the one people trivialize. It could also be complicated. And when it's complicated,
but it goes from simple to complicated.
Yes, if it is not well treated, it now becomes complicated malaria, where we have this cerebral malaria that we talked about. You see people, they are unable to walk, they are unable to eat. They are, you know, the level of consciousness is reduced. They go into coma and death can ensue from this malaria we trivialize. Health education, raising awareness is the way to go around it.
Okay, let's just look at the situation where somebody dies and the next thing is ordinary malaria of 2 days old, or ordinary malaria of 24 hours.
What happens is that it's been in the system. A lot of multiplication is going on in the system. It differs. For some persons, within 2 weeks, they come down with malaria. For some persons, it can last between 8 to 30 days. It will just be in the system, multiply. Then it gets to the liver, it multiplies, it has a name. Then that goes back to the red blood cells. Then it begins to lyse the red blood cells. It breaks down the red blood cells. As it's beginning to break down the red blood cells, the person is becoming anemic. Not enough red blood cells to circulate in the body. The person will begin to have respiratory distress, and from there the person can just die. So it's from the complications which has been there, but because of this trivialization, people don't get to treat it on time. So they tell you it's 2 days, it's actually not 2 days. It has actually started a long time ago. But they just, malaria, it comes in bouts. As these liver cells are releasing these parasites, and as they're attacking the red blood cells, the person comes up with fever. Okay, comes up with a bout of fever. Then after that stage, the fever can subside, and the child begins to play. And then they say, oh, nothing is happening. They give the child paracetamol. Paracetamol sorts the fever, and it ends there. Then the next day, a bout is released again. Fever comes up again. In some type of malaria infection, it can be every 4 days. The one that is caused by what we call falciparum malariae. That means the person will have a release today and have fever. It will be 4 days time before the child will have fever again. Evident fever. And then the person just feels that this child has been playing. But meanwhile, between this period, is crushing down this child's red blood cells. So it's actually not 2 days as the way we see it. And then it has been on, and then the person now comes down with organ damage. You can have, liver damage, you can have respiratory distress, even pulmonary edema can ensue from all that. So that's why we just come down with sudden death, and they say, oh, the malaria was
just a day or
started
two.
yesterday.
All right, if you're just joining us, the program is Healthy Living on independent television, and we're looking at malaria, causes, treatment, and management and possible prevention. And like the doctors will say, prevention is better than cure. So I have 2 doctors in the house, and I expect you to call them, ask questions. There is no point in asking your neighbor who is not a professional, who is not even anything near health official. Please, I want to appeal to mothers especially. There are doctors in the house. You need to ask questions instead of loading your children, loading them with drugs that you don't even know anything about. And Dr. Lucy is here and Dr. Mary is here. And Dr. Lucy, you did say that between 0-6, that's where the problem really is.
From 6 months.
From 6 months to 5 years. So
yeah.
How do we help these children?
Yeah. That's why we are mothers, we are women, and we are doctors.
That's awesome.
Yeah. What we are doing now is part of the help we can help by educating the mothers. And also, for school-age children, they can also be given prophylaxis. You can treat them just like we also have when we give to pregnant women.
Yes.
During antenatal clinics, they can be treated prophylactically. And also, we have to know that there are ways to prevent this disease. So if we can talk about prevention, we'll go a long way in helping the children.
Okay, so let's look at prevention, and I'm sure people are trying to call us now. The phone numbers are there on your screen. Please use them. Call us or send us WhatsApp messages. We will definitely take all of them and give you answers to your questions. All right, so Dr. Lucy, as you were saying.
Yeah, the prevention. Avoiding bites of mosquitoes. Very, very essential and important. Avoiding stagnant water, having a clean environment, because we know that when you have stagnant water, they are breeding grounds for mosquitoes. Sometimes some people have tanks and containers where they put water as storage facilities. These tanks and containers should be closed. If you leave them opened, the mosquitoes can actually breed there. So we avoid stagnant waters, we clean gutters, we sweep our environment, and also make sure the children are well covered. We cover them appropriately. Then the issue of the insect-treated mosquito nets, we should use them as much as possible. It's been advocated at different government levels. They are giving out these ITNs, the insect-treated nets, so they should be used as much as possible. The insect repellent is also another thing that can be used to prevent malaria.
No, let's look at this net first. We'll take it one after the other. I know some people, at least I've come across some people that will say, no, I can't sleep under this net. They cause heat.
Yeah.
They disturb my children. They don't allow my children to sleep, so there's no way I'm sleeping under it.
Yeah.
So what do we say to these kind of persons?
Well, like we said, prevention is better and is cheaper than cure. Would you rather allow your children to be bitten by mosquito and come down with severe complications of malaria, which can ultimately lead to death, or for that period, you can actually make your environment conducive enough when you're using mosquito nets. If you have windows, so long as the nets are already there and they are already insecticide treated, they can actually prevent, this malaria. So you can use the mosquito net, open your windows, and allow good air to also come in to make sure that these children are well protected. So we're going to appeal to as many parents as possible. Now what you look at, like right now, it looks like an inconvenience, but on the long run, it's very, very, very beneficial to the children.
Okay, so that's one of the ways we can prevent it.
That's the way to prevent malaria. Then the use of repellents, mosquito repellents, can also prevent malaria. So we also advocate that they do that. Then most importantly, they should make sure their environment is clean. And that's the least they can do. I don't think they will need so much money to do that, because there's issue of people always complain, no money. At least to keep your environment clean, you don't need money, as it were. All you just need is to be self-disciplined. You make sure you don't have water, stagnant water, containers.
No, but you know we have stagnant water.
They can sweep it off.
Plenty of stagnant water in this. Let's take Edo State as a case
yes,
study.
as a case study.
You go to a lot of places, you see people, despite the fact that you find one government agency or the other trying to dislodge gutters, by the next day, those drainages are full again. And you keep wondering, what do you want government to do again?
Okay. So that's why we're actually educating people, that they should, as much as possible, prevent. Because if you know that something is life-threatening to you, if you know that something is detrimental to your health, then I think the least you can do is just to do the right thing. Right thinking is very important. If you do the right thing, by keeping your environment clean, you are taking malaria very far away from you. So that's the least that can be done, even without money. Even the issue of the mosquito nets, I think at the federal government level, they are also distributing nets. Very recently, during this World Malaria Day, we as female doctors, we went to the IDP camp, and we distributed mosquito nets to them freely, amongst other things that we did there.
See, apart from this mosquito nets, let us look at treatment in the hospital. How cheap, how affordable is this treatment in hospitals? Because if you go to some countries, they will tell you that from this age to that age,
you have free drugs.
You have free drugs, you have free treatment.
Yeah.
What's our case here?
And they, you know, a few years back, when Quatem, I call it the Quatem drug came in,
yes,
they were free drugs donated to different hospitals. But right now, the malaria drugs are not free. They are not free.
So, how is the government helping us apart from mosquito nets? How are you also helping us as medical women association in Nigeria?
Medical
especially
women.
at those states, and you're the chairman.
Yeah.
How are you helping us?
Medical women.
And how is the secretary also helping us?
Oh yeah, medical women. We also are seeking for help and support from more meaningful Nigerians, because we are going about doing advocacy. We are going about giving as much as we can. But we should also realize that we are just a group that also needs to be funded. We
believe that you're closer to the government, and as women, as mothers, we believe that you will be more sympathetic.
Now you are saying it.
I'm sure that mothers out there, by extension, especially that one who is in the village, who cannot really access healthcare, will be able to go to any functional healthcare center nearest to her to get treatment
for malaria.
That
is why we are here, and that's why we are advocating. That's why we are appealing to as many as will listen, that we need to help the less privileged. We need to go to the grassroots. Do you know, as medical women, we are trying to do a lot, but I can tell you, all that we are doing may not be enough, because we are talking about a large group of people. It's as good as very soon.
Don't run away from my question. How affordable
is anti-malaria? Well, they are not so expensive. If you look at it relatively from other drugs, they are really not too expensive. So they are still affordable. They are affordable. Anti-malarias are affordable, and I think people can actually afford them.
Okay, we have a call. Hello, caller. Okay, we just lost that call. Please try and call. You need to ask questions. You know, the idea of hiding inside your house, thinking that you will cure malaria by yourself, is not so good. Like you heard the doctor say, you may succeed in doing that for like 3-4 days, and in another 4 days or 1 week, it will come again with full force. What will you do? So, doctor, back to you.
Yeah, the cost of anti-malaria is affordable. They're not really very expensive.
Would it be out of place for government to say, okay, malaria treatment is free?
It's free. Sincerely, it's not going to be out of place. That is what we are advocating for. That is what we want the government to do. That's one of the lists that can be done to actually prevent this highly infectious and life-threatening disease. The children we're talking about are going to be leaders of tomorrow. So it's good that we preserve them now. And it's good that we make sure when they have this illness, they are treated properly, so they don't come down having complications in future. When they have complications in future, it ultimately affects their productivity.
You know, some people will say, this doctor is just talking.
Yeah.
Malaria that I can treat by myself, by going to my backyard and get 1 or 2 herbs and I am done. What is she talking about? You know, I really need you to hammer on this so that that woman, that man, that boy, that girl out there who does self-medication, we know that this is not a joke. Malaria is a serious business.
Yeah. You know, in this part of the world, we believe so much in tradition, our culture, and all that. Malaria is a disease.
Okay, doctor, just hold on. We have a call. Hello? Good afternoon. What's your name, please?
Okay, my name is Sonia.
Okay, doctor is here. Ask your question. In fact, 2 of them.
Okay, ma'am. The causes of malaria,
Yes.
In my community, it's mosquito. Is there any means that we can prevent this?
Please, can you ask your question again? Hello?
I think I got her question.
Okay, all right.
She said in her community,
Yes.
that mosquito is a major cause of malaria. That's the cause everywhere,
Everywhere.
apart from even your community. So, what we are talking about this afternoon is that mosquitoes can be prevented from actually getting to us. And how can we prevent mosquitoes? In that community, we're almost certain that you have environments that are breeding grounds for mosquito. So you try and make that community as safe as possible and prevent the breeding grounds for mosquito in that community. The issue of mosquito nets can also be used, and we also can use insecticide repellents to prevent mosquito in that community. So as a community, people can come together and say, how can we keep our community clean to prevent malaria?
Okay. Hello? Good afternoon. Hello, caller. Hello? Please reduce the audio level on your television set so that we can talk. Hello? Please reduce the audio level on your television set, please. Hello?
Hello.
Hello, good afternoon.
Hello.
Hello, good afternoon.
Hello, good afternoon.
Please tell us your name and where you're calling from.
My name is Precious. Hello.
You're Precious.
Yes, ma'am.
Okay, so ask your question,
Hello, ma'am.
Precious.
The malaria is talking about now. I have someone who has malaria. The ever to start, the malaria does not, there's no cure for it.
No cure for it. For how long?
Going to 3 weeks now.
3
3 weeks.
3 weeks now. Okay, Dr. Mary.
That's where the issue of resistance comes in. If the person has been taking the right drugs for 3 weeks, it actually means that most probably the drug the person is taking, the person has developed resistance to that drug. Probably the person has taken the drug some time ago and didn't complete the dose, and so the parasite is now resistant. So what the person will need to do is to consult a doctor, tell the doctor what he or she has been taking, and then they could probably now switch to another class of drug for that person. Again, malaria is endemic here, yes, that's correct, but it could also mimic other illnesses, viral illnesses. So that's where proper diagnosis is actually necessary here. In the past, we used to say, oh, fever equals malaria. It's not actually all correct. So we need diagnosis. And diagnostic tests, rapid diagnostic tests, they are available. Microscopic examination of blood film is available. So proper diagnosis is also important in that person. Otherwise, what happens is that when the resistance develops, the person treats the malaria and gets a bit better, then some residual parasites get there, residual in the system, and then they begin to produce and proliferate again and multiply, and then they come out and the person comes down with malaria. So these are the options for the person.
Okay, hello? Yeah, good afternoon. Okay, ask, what's your name?
My name is Godwin.
Okay, please ask your question.
Yes, there are times you have this malaria, and we are told that one of the symptoms is temperature. There are times you don't have temperature at all, and you go to laboratory and you say you have malaria. How can you? How this one come about?
Okay, that's why we said one of the symptoms is fever. It doesn't mean that that's the only symptom. That's where the diagnosis is very important. Yes, somebody could be positive for malaria and will not have that high fever that is, just expected. But sometimes when you actually do maybe use a thermometer to check this person, you find that the temperature is raised a little. Okay. But this person will not have the bad fever, chills, and rigors that this person is expecting. So it's possible. It's possible. Once the test says, oh, you have malaria, and you feel you don't have that kind of fever we're talking about, yes, it's possible to have such.
Okay. Hello, good afternoon. Please tell us your name and ask your question.
My name is Kate. I'm calling from Benin.
Okay.
Hello.
Hello, we can hear you. Ask your question.
I've been having malaria for over 4 weeks now. I want to check.
You've been having malaria for over 4 weeks.
And it's not working. The malaria is there.
Okay, Dr. Lucy, you got that? She's been having malaria for...
Hello.
Okay. We can hear you. We can hear you. All right, the doctor is going to respond to you now.
Yeah, someone that's been having malaria for over 4 weeks, I think it's the same thing that we are still saying, like what the other lady asked just now. It's possible the person is now building resistance to some of the drugs that are being abused. Because most malaria drugs, some of them are just start. You take the drugs and it's a start-on dose and you end it there. But many of them, you still have to take them for like 3 days. What many times happens is that when they take it once and they feel better,
that's the end of
That's the end of it. So such people are bound to build resistance to these drugs, so that when they take it, when they are not really very ill, it seems not to be working according to them. But it's just because they have not built resistance. And like we also said, this malaria comes in bouts. You might feel better today, and you still have the parasite within you. It multiplies, it proliferates and reproduces again, and the person still comes out with malaria. So such person should go for a proper diagnosis. You go for a blood film, or the rapid diagnostic test kits are used, and malaria is diagnosed. You can also go further to also investigate other causes of fever. Fever and headache is a common symptom, which other things could still be responsible for. So they have to rule out other problems that also mimic malaria symptoms before you cannot say outrightly you have treated malaria and it has not relieved you. Because normally when you treat for malaria, when you use the drugs accordingly and appropriately, the person should get relief and feel better.
Okay, we'll come to that. Hello, good afternoon.
Hello, good afternoon.
Good afternoon.
Hello,
it's you who?
Esther.
Okay, Esther, how are you?
I want to talk to our doctor that is speaking with us.
Okay, ask doctor the question.
When someone is treating malaria and the malaria does not resist by the drugs you are taking, what is next to do?
Okay. She want to know what she should do if one has malaria, taking drugs, and the drug seems not to be working.
We are saying the same thing over and over again and again. The thing is that it's endemic in this part of the world. Sometimes it could just be outright relapse. What we mean is that, oh, the malaria has not been properly treated and it's coming up again. It could be a reinfection, that you treated malaria today and you're still exposing yourself to mosquito bite, does not prevent you from having malaria a month after. So the person should ensure that as you're treating the malaria, you're not exposing yourself to rebites.
Okay, Dr. Lucy, let's look at the issue of drug use.
Yeah.
When one has malaria. You just said that. Okay, let's take this call. Hello? Yes, good afternoon.
Good afternoon, madam.
Yes, good afternoon.
What is your name?
It's you who?
Good afternoon, madam. I want to ask. Sometimes you say...
You didn't tell us your name.
Oh, sorry, I'm Mr. Ike from Fiogo.
Okay.
The doctor say at times that when treating malaria, we should treat that's what I'm wrong with it. As some time ago, somebody came and said it was wrong. So what is the idea?
Okay. So some doctors say when you're treating malaria, you treat typhoid along.
Actually, the symptoms of typhoid fever are so classical that you can't walk up to the doctor and say, oh, I have typhoid. So by the time you're walking up to the doctor and saying, I have typhoid, then he hasn't really got into typhoid. But
so how do you get to that stage?
What happens is that commonly people just treat for malaria and typhoid.
Together.
Actually, they haven't gotten typhoid.
Okay.
They just have malaria.
In fact, most of the diagnosis of fever is malaria and not typhoid. I tell a lot of people when they come and they say, I have typhoid. If you have typhoid, you won't even walk in the way you have just come in, still looking healthy. But one thing they must also know is that malaria can also present with abdominal discomfort and pain. So if that is established, that malaria can also cause abdominal discomfort and pain, then all abdominal discomfort associated with fever may not necessarily be typhoid.
Okay, so Kola, you got that. Now we're looking at, do we have another call? Hello? Hello? Okay, no call yet. We're looking at drug use. You said a while ago that some people, when they take for today and they say that they are better, they forget about taking the drugs again until another bout of fever comes.
Exactly.
So can you just explain to us the proper use or the proper way of taking drugs?
Good. You have come to the hospital to present to a doctor who is a specialist, who has actually studied and knows that this is what you require to take. So please, I want to admonish our viewers out there and the general populace at large that when a prescription is given to you, it will be written, take it so duration and for a particular period, please just comply. If you have to take for 3 days, even after the first day you take it and you feel better, please do not throw the drugs away, complete it. It's for your own good. If you complete it, it will help to eradicate completely and take care of that problem at that time. And at least you know that you are free and you are good. And you can continue with your other things, other lifestyles. But when you take for 1 day, because many times when you start anti-malaria, you feel better. You just feel relieved. You take it for the first day and you are better. Don't be tempted to stop it.
Okay.
Complete it for as long as you are asked to. If it's for 3 days, please take it for 3 days.
Okay, let's look at the issue of taking the drugs, in a very strict manner, maybe regimented manner.
Yeah.
You have to take it for exactly. If a doctor says take this particular drug morning, afternoon, night, what's the best time to take this drug in the morning? What's the best time to take it in the afternoon? What's the best time to take it in the evening?
Okay, when you talk about the best time to take drug, when you're in the hospital, it's easier because it's actually said at maybe 8 a.m. you take it. If it's a 6-hour drug, you take it after 6 hours, and after 6 hours. It's strict. You're able to follow it. It takes a lot of self-discipline. Many times people take drugs after a meal. It also depends, because there are some drugs that they will tell you to take before. But if you're actually told to take it after a meal, then you take it after breakfast. But at this time, because you know you are taking drugs, it's good to take it at a particular time. We always tell people when you're asked to take drugs at intervals, we tell you, okay, you're going to take it 8 a.m., make sure you take it 8 a.m. every day. So you take it at that time. 6 hours after, you make sure you take it. Sometimes you're not at home at that time. Why don't you go with your drugs and take it at that time? But what people do, please, one thing I also want to admonish people is that you have a drug to take, you miss it in the afternoon, you now want to take double dose or triple dose
in the evening.
In the evening.
Wow.
No, you're not supposed to do that. You're supposed to take it as you are told to do it. If you take it at 8 a.m., make sure the following day you're also taking it at that time. It's a lot of self-discipline. And when it comes to the issue of treating malaria, it's not for so long, unlike some other conditions where you have to take it for life. Okay. So you take it as at the same time every day.
Okay. Hello? Okay, we missed that call. you know, sometimes, like you said, you miss the one for afternoon, and then you want to take double dose in the evening. If you miss the one for afternoon, you skip that, and you take the one of evening, would the drug still work?
Actually,
you take morning, you skip afternoon, or maybe you even skip that of evening. Will it still work?
Actually, you have altered the process, because drugs that are taken 3 times a day, it means that there's a particular half-life after which the drug is out of the body, and taking it late, you actually alter the process. But the best thing one can do is not to take the double dose. You can stay late in the night and take a 3rd dose, so long as it's within the same 24 hours. That could help, because let's be practical about this.
Okay.
Yeah, if you miss your afternoon drug and you just remembered maybe around 5 p.m., oh, that's when you're taking your afternoon. Yeah, you can take the other 3rd dose late in the night
instead of skipping.
Yes.
And it will still work.
Yeah, it will still work, so long as it doesn't repeat itself the next day.
Okay. So somebody's asking the drug to use when you have malaria. We don't talk about drugs on the program, okay? Just ask doctors questions, situation questions, and then you will get answers, not the drugs to use. All right, I have treated malaria 3 times this year. I'm also pregnant. What can I do? It's disturbing me so much. My environment is clean, and I don't know the cause of this malaria.
The fact that this person is pregnant makes the person to be at risk, because it's a risk to the fetus to have malaria. I think the best thing is to talk to the doctor, because actually at every stage of pregnancy there are some specific drugs that you can take. So you don't just take drugs anyhow when you're pregnant. Therefore, alliance with the doctor managing this person is the best solution. And again, like we said, we have to rule out other things. Let's not just equal every fever to malaria, like it was said in the past. It's not always so.
And also, to add to that, for those that are pregnant, you should also know that the first trimester of pregnancy is a period that is not safe to just use any drug indiscriminately. So you must see your doctor. You are pregnant and you are having malaria over and over again, you must see your doctor, because you also know that during pregnancy your immunity is actually depressed. So you must see your doctor, and you'll be advised appropriately and given the drugs to take at a particular point in time in that pregnancy. I'm sure if this lady does that appropriately, she'll be fine.
All right, we got this other question. Good afternoon, my name is Bimbo from Benin. Is it advisable to take blood tonic and vitamin B complex while on malaria treatment?
Yes, we've heard a lot of things that, when you're taking the anti-malaria, you're not supposed to take what we call hematinics, because the blood is crashing. The one you're taking is, the malaria parasite is crashing. No, it's not correct. That's not from the doctor. That's what we hear from the layman.
Okay.
Yeah, when a doctor prescribes anti-malaria for you, the doctors add what we call hematinics. As the anti-malaria is, reducing the load of parasite, the hematinics or blood tonic, like it's being called, is helping you to build up the blood. So take anti-malaria, and when you're giving blood medicines, add it to it and take.
All right. Is malaria the cause of jaundice in children?
Oh, yeah. Malaria can. When we have, when I talk about complicated malaria. When you have complicated malaria.
Can you just describe this complicated malaria?
Yeah, complicated malaria is also known as severe malaria that could occur. Like we said, one of the main complications could be cerebral malaria. Where you have the parasites now in the brain. And when you have it there, it can now cause things like seizures. The patient can become delirious, can become unconscious, and ultimately, if not treated appropriately, can come down and can lead to death. And when the patient has malaria, we also said that these parasites, they move to the liver. There they reproduce and replicate, and from there they move back again to the system. So it can also be there and cause more damages. The person can have liver enlargement, hepatomegaly, can have splenic enlargement, can have all sorts of, any form of complication.
Malaria does all of this?
Oh yes, malaria does that. That is why we said when you have malaria, it's good a prompt diagnosis is made and treated early. Early treatment, early diagnosis and treatment actually will prevent the complications of malaria.
Okay, so let's look at malaria and jaundice in children.
Yeah.
Malaria and jaundice in children, like she rightly
Like
said.
newborn babies.
Yeah, actually the cause of jaundice in newborn babies is not malaria.
Okay.
Because the child has immunity as a newborn baby. So it's not likely. We have what we call birth asphyxias. Those are another complications of
you know, sometimes you hear people say, oh, the mother was so sick. She was always sick. That's why the baby came out with jaundice.
Yeah,
you know?
if the mother was so sick, what probably the illness of the mother may have affected the child. It could result in birth asphyxias and all of that, but not directly malaria.
Okay.
Because that's why we said from 6 months to 5 years. Because from 0 to 6 months, it's expected that the child has immunity cover. So in jaundice in newborn babies, you don't attribute it solely to malaria. It's because of other birth complications.
It could also be physiological. Because we have what we call the physiological jaundice in newborns. So it could also be physiological jaundice, not malaria. And it's very unlikely for that child to be born and say the child has malaria. Though it's possible, because never can say never. The mother, like my colleague just said, the mother that has been quite ill can also transmit to the children.
All right. Is it only mosquitoes that causes malaria? And what is the difference between fever and typhoid?
What is the difference
between fever and typhoid? That's
fever
the question we have here.
Means high temperature. Your normal temperature is raised. That's just fever. Typhoid is a disease that is caused by another organism. So that's a disease. Just like the parasite we're talking about causes malaria, so another organism causes typhoid fever. So there are two different things. So they are different. Fever can occur anywhere. Someone that has viral infections, an example we heard of Ebola in recent times, such people can come up with fever. So fever simply means high temperature.
Yeah, there are two major organisms. The malaria is caused by Plasmodium falciparum, and typhoid is caused by Salmonella typhi. So they are two different organisms.
Okay.
But a lot of people mix them up. And it's
you know, the thing is, once somebody is a little bit ill, oh, I have fever.
Yeah.
You know, it's always like that. So the difference between malaria and fever is just too slim for a lot of people to know that, no, this is different.
That is why we have to make a diagnosis.
This is different. But how many people want to go to the hospital to go run a test for malaria, ordinary malaria?
Yeah, we keep on saying it, that prevention is cheaper than cure. Okay, you don't want to go to the hospital to make a diagnosis of ordinary malaria, and you come down with complicated malaria. Yeah, you have to spend a lot of money. So why don't you do the very least of making a proper diagnosis?
You know, even as we're here discussing this topic, there's somebody out there who is swallowing drugs. I beg, with you, these people they talk. That's their own. You know, I have been doing this myself and it has been working. Can you just tell us the dangers of this?
The person runs a risk anyway, because over time, by the time the person develops resistance, the person is likely going to come down one day with this severe malaria we're talking about. In addition to what has been said about this severe malaria, you find that the person is not able to walk, is not able to talk, is not able to eat. And they say, is it malaria? Yes, this person has had it and has been swallowing drugs the way this person is swallowing drugs. Now, then, this issue of complicated malaria, let me go a little bit to say that the economic burden of malaria is high. Let me give an example. It causes impairment, disabilities, intellectual disabilities in children that will stay with them for life. How does it happen? This person had malaria, the mother didn't take it serious. Keeps giving paracetamol, and the thing now became complicated and affects the brain. And then the person, what we call cognitive impairment, sets in. And this person is going to perform suboptimally in the whole of this person's life. He's not going to put in the best in productivity. So the dangers of malaria is more than what we're talking about. Just digressing a little, the economic burden of malaria is actually high. Yes, these drugs, they are not so expensive, but how many people actually have money to buy these drugs? So the cost of treatment is actually high. That's why we're emphasizing prevention. What about days lost at work? The secretary has malaria, so he's not able to come to work. Files are on the table, they are not moving. That is a loss. That's economic burden. This person has malaria and is able to go to school. The child has lost days in the school. That's economic burden. So the malaria we're actually talking about is not just the way we're saying it.
The way we're saying it, the way we're talking about it, ordinary malaria. Ordinary malaria can actually damage somebody's life forever. One can even die. You heard what the doctor said. A child has malaria and that child is not properly treated. It will definitely affect that child tomorrow. The productivity of that child in anything and in everything will be very low. And doctor, you also said that it may also disturb, fertility and all that when the child grows up. Will it disturb the child?
No studies.
Because most women now will be gingering up. No, this can't happen to my child. When they hear things that can really damage a child's life in future, some women are ready to run.
Malaria will damage a child's life in future if not properly taken care of. It will damage a child's life. A child that has missed out as a child, is not able to go to school properly, has lost days at school, becomes an economic and it becomes a problem to the nation. So it's good that malaria is prevented and, if not possible, treated when diagnosed.
Okay. All right, people, we must at this point thank Dr. Lucy Eriba, who is the chairman, Medical Women Association of Nigeria, Edo State Chapter, and the secretary, Mary Ehimigbai. So they have done us well on this program. Listen to me, woman and man out there. If your child has malaria, please go to the hospital. When you see your child down, just go to the hospital. Don't even think that it is malaria. Let a doctor tell you that this is what this is, and then get proper treatment for that child. Even as an adult, if you feel somehow, just go to the hospital. It will not cost you much to go to the hospital. And self-made, honestly, can kill you. We'll see you again on Monday. Bye for now.